Millions of Americans may be at risk of losing financial assistance that lowers the cost of health insurance brought through the Affordable Care Act's marketplaces. The so-called enhanced subsidies were passed under the Biden administration, but they will expire at the end of 2025 unless lawmakers choose to renew them. Healthcare policy experts estimate that the subsidies have cut premiums for eligible enrollees by 44% or $705 annually on average. Experts say if they are allowed to expire, average premiums for subsidized enrollees in a dozen states will double. CBS News MoneyWatch reporter Megan Cerullo has been digging into all these numbers for us. She's here with me in Studio 57. Megan, always good to have you. So Congress needs to make this decision to renew these subsidies. How likely is that to happen now that Republicans are coming into charge in both chambers?
Good to be with you, Lana. So it's important to note that these enhanced subsidies will remain in place through the end of 2025, no matter what. Also important to note is that Congress doesn't have to do anything and they will expire. So Congress has to take affirmative action in order to extend the subsidies. And the Trump administration and key members of Congress have signaled that they do not support an extension of the enhanced subsidies. That could be because it's quite costly. The Congressional Budget Office estimates that it would cost $335 billion to extend the enhanced subsidies for a decade. Indeed, many Americans are at risk of losing their health insurance.
Well, we know that during the first Trump administration, he had run on a platform of repealing and replacing Obamacare. That didn't happen in part because, as unpopular as it was more unpopular to actually repeal it. So is there a possibility that these many millions of Americans, and I'm hoping you can specify exactly how many are going to be impacted, might actually convince their lawmakers, Republicans or Democrats, to keep these subsidies in place?
You asked about numbers. 21.6 million Americans are enrolled through ACA marketplaces or exchanges. And of those individuals and American households, 20.1 million, so more than 20 million Americans rely on these enhanced subsidies that they could lose. That doesn't mean that all of those people will lose their health insurance, but for many it could become unaffordable. The Congressional Budget Office estimates that without them, 3.4 million Americans could drop their health insurance altogether.
And Megan, in talking about some of the other Biden administration initiatives that might be on the chopping block, we know that where they are also might have an effect. If they're in a red state, those Republican lawmakers are more likely to lobby for congressional allocations. So I'm wondering, where in the country are people most likely to be affected?
First of all, in rural areas where there's less competition and premiums tend to be higher, those folks could be affected. Additionally, for low-income people making 150% of the poverty level, if they lose enhanced assistance, they'll still get some assistance, but simply put, health insurance could become unaffordable. Then there's another group of Americans, folks who make just above 400% of the poverty line, so moderate income Americans, who won't get any assistance at all without these subsidies. And that could mean that they're spending no more than 8.5% of their income on premiums to over 20%. And that could lead them to say that this is simply unaffordable. And those folks could also drop their health insurance.
All right. Megan Cerullo, thank you.
Thanks, Lana.